Hey everyone, we are at the Barbados Fertility Center this morning and I'm with Nurse Anna. She's like my person. And we're just going to talk about the entire process and also, I guess recapping everything that happened. So,
How are you feeling, first of all?
well, last week I feel like I had the bloat from doom, but but I'm feeling so much better. It just lasted a week.
Okay.
And my stomach has all these little tingly feelings going on. And but yeah, I'm feeling great.
Okay.
I'm feeling great. The discomfort really was a lot shorter.
Then
Yeah, because in the moment I was like, oh my gosh, when is this gonna end? But
It
like
did.
probably within 5 days, I
Okay.
started to feel a lot more comfortable.
Okay.
And when I called you and you were like, your ovaries were good to you, relax yourself. I think I felt a lot better because I was wondering, is this normal?
Yeah.
And
Well, you
so
got
I
16 eggs, which is a great number.
Yeah.
And so the ovaries did get a needle into them.
Mhm.
So even though you've no cuts or wounds on your tummy, so, they do like to tell you a little bit that they've been injured, so that's
Right.
okay. And rest is really rest and Panadol, and that's enough. You don't need anything stronger than Advil or over-the-counter Panadol. And, and rest, because the ovaries do have to shrink back down. They were enlarged from the medication, so it's important that all you need is rest, and within a few days they just literally get back to their function.
Yeah. I had my first workout yesterday.
Oh, you did?
Just cardio.
Okay.
So I'm feeling back to normal.
Okay, yeah, exactly. Your head is back to normal.
Yeah.
So I guess sitting on this side of the egg collection, or the egg freezing process, looking back, how would you describe it?
Honestly, someone asked me this question recently, and I said to them, it's really over before you know it. And when you're in it, you just want it to end because I don't want to take any more shots. But it's done. I'm so happy it's done. I mean, I'm walking around, people going, "Your eggs are frozen." I'm like, yes, it's all done. It's all done. And it is worth it. It is worth it to go through all of that to get to this point.
Yeah, okay, good.
Yeah.
Well, I guess just to recap on the process, so three steps really. One is the decision to do it, which was a big decision.
Yeah.
And you made it, and that's a brave step. Second then is the injections, and I guess you do have 2 to 3 weeks of injections every day, so it does seem to drag on a little
That
bit.
part's a bit daunting.
Yeah. But then once the egg collection is 20 minutes with some sedation, you don't feel anything, and then after that the eggs are frozen. It's really done.
Yeah,
so
it's pretty quick.
yeah, it is.
Pretty quick.
And now the eggs are frozen forever,
Yeah.
as long as you want them, obviously.
So they don't expire or anything?
No,
like
they
that?
don't expire. The new vitrification freezing process that we have means they can stay frozen indefinitely.
Right.
We have an age cutoff. You're 50, so you'd have to use them before you're 50.
Okay.
But you have 16 eggs, and the studies show that the best success, obviously, for freezing eggs is for women under 37.
Right.
Under 35 is even better.
Mhm.
But under 37, they've done the studies to show that for every 8 eggs that you get frozen, you have a very, very good chance of having 1 baby. So you have 16 eggs, so
Good for 2.
hopefully good for 2. Obviously, like anything, it's a statistic, so it depends on the eggs when we thaw them and how they look and how they survive and everything. But right now you're in a good position with 16 eggs. 16 eggs doesn't mean 16 babies, right?
Right. Some people are
Because-
thinking that. They're asking me, we've got 16 eggs, so are you going to have 16 babies?
No, because not every egg is good, right?
Right.
As women, we don't release a normal egg every month, and that's why women have to try month after month oftentimes to get pregnant. But so 16 eggs, if we thought 8, say, and we fertilize them, by the time you see how they develop and grow and expand in our laboratory, usually 8 eggs is equal to 1 or 2 babies, really.
Okay.
Of course, it's not guaranteed either, but you have a very good success rate at your
It's
age.
a 4% chance that it won't work, right? But more like a...
Yeah,
it's a
4% chance they won't survive the thaw.
Right.
And then the pregnancy rates are about 50 to 60% in your age group with 8 eggs, so you've got double that. So it's really good.
Good.
I know a lot of people were asking about the cost, and I think that's important that we address it.
Yes.
As you know, the cost is 10,000 Barbados dollars, which is 5,000 US. And that's for the entire process. So the scans, the egg collection, the freezing, etc. What's not included in that is the medications. Everybody's different. So a 21-year-old freezing her eggs is going to need less meds than a 36-year-old freezing her eggs, because it depends on how the age of the woman and how their hormones are will depend on how many meds they need to stimulate their ovaries to get eggs.
Right.
So the medication cost can be anywhere from 1,000 to 5,000 Barbados more, depending on their age, their hormone level, what their ovaries need to produce eggs. And then that's it. After the first year, there's an annual storage fee of keeping your eggs frozen of $550 US, which is 1,100 Barbados. And yeah, we just keep them on ice until you're ready.
Wow.
Yeah, it's very exciting. It's
Yeah.
done. You have them frozen.
I'm very happy. I have peace of mind now.
I know, it's like, it seems like a lot of money, but it's an insurance policy.
for
It really
sure.
is. It gives you peace of mind.
One of the questions I've been asked also is, so obviously women who are over 40 might have some issues when they're pregnant sometimes. They have
Yeah.
some problems.
Mhm.
So if they have their eggs frozen and then decide, oh, at 45, let me try to have a baby.
Mhm.
The eggs are there, maybe the embryo works and then she gets pregnant.
Mhm.
Is she going to have complications still? There's a chance that she can have complications.
Well, there are two different complications. One is the complication to the child. So if it's genetically abnormal or normal, I presume you're talking about. So the younger the eggs are, the less chance there's a chromosomal abnormality.
Okay.
So if you're having a 44-year-old woman pregnant with her 44-year-old eggs, you've got a higher chance of the baby being abnormal
Got you.
than a 44-year-old woman with 34-year-old eggs.
Right.
But then, of course, the older the woman, the more chance of maternal complications, with preeclampsia, high blood pressure, premature labor. So again, that's just age-related for the mother, regardless of what age the eggs are.
Right, okay.
So there's two different factors there.
Okay, good to know.
Well, yeah, the younger the egg, the better.
Yeah.
It's the sad truth about our reproductive age, but that's why egg freezing is such an important advent for women. It really is.
Are a lot more women coming in to do egg freezing?
Yeah, and you talking about it has been really instrumental. People are aware, and people since you started posting about it, a lot more women have even reached out to ask the question.
Great.
Because it's important. It empowers women, and
Yeah.
that's important.
Yeah, that's true.
Yeah,
That's
so well
really-
done for you.
I keep telling people it's bigger than egg freezing.
It is.
It's about you and empowering yourself and making a choice for yourself. And it
Yeah.
feels good.
Yeah.
You feel like you're a lot more in control of your life.
Yeah.
So I
well
think
done.
for that reason, it's a great step.
Yeah, and it's not easy to go public about something like that.
Mm.
So yeah, you get a lot of comments, negative and positive.
Yeah.
So well done.
Like, this doesn't make any sense.
Yeah, no.
Like,
yeah.
well, it makes sense for me.
Yeah,
It
that's
may not
right.
make sense for you, but it makes sense
Yeah,
for me.
you did really well.
Yeah.
Good.
Thank you.
You're welcome. Well done.
You know what else the $10,000 include? Emailing you all the time. You're always available to answer questions. And I have to say that the Barbados Fertility Center has been amazing. Dion, Sterling, Rachel, everyone I've been talking to, there's been complete easy access. I can ask any question and not feel silly.
Good.
Every question is answered. So I really do appreciate you guys.
You're welcome.